father and his children looking at the screen of a single phone, weeping and saying their last farewell to a woman who is a mother for children and wife of the father. The woman was once a doctor at the hospital, but she is now a patient, a dying patient due to a virus which is known as COVID-19. It was their first video call since COVID-19 outbreak, and probably their last. I don't know them, for they were just strangers whose story was featured on television. But one thing is for sure, they went through familiar pain and difficulties. I was a grade 10 student when I first heard the virus named COVID-19, and after just a few days, the World Health Organization declared the virus as a global pandemic, which causes the country, economy, school, and life to shut down. Honestly, at first I thought the idea of having the virus as a pandemic would be fun, because there will be no classes and I will be free to do everything that I want at home. But as time goes by, every time I see the news report about death and suffering, I realize that I was wrong, because the virus brought a lot of destruction to the world and life. What is COVID-19? COVID-19, or coronavirus disease 2019, is an infectious disease caused by the most recently discovered coronavirus. How about coronavirus? What are coronaviruses? Coronaviruses are a big family of different viruses. Some of them cause the common cold in people. Others infect animals, including bats, camels, and cattle. SARS-CoV-2 is the most recently discovered coronavirus, and experts said that SARS-CoV-2 originated in bats. The virus was originally identified in China in 2019 and became pandemic in 2020. How COVID-19 spreads? COVID-19 spreads when an infected person exhales droplets or small particles that contain the virus. It can be by coughing, sneezing, or even just by simple talking. The droplets and particles can be inhaled by other people and can land on others' eyes, nose, and mouth. In some circumstances, they may contaminate the surfaces they touch. People who are closer than 6 feet are most likely to get infected. Mainly, the virus can spread through close contact from person to person. What are the symptoms of COVID-19? Symptoms of COVID-19 typically appear 2 to 14 days after the exposure from the virus. Symptoms can be mild to severe, and some may not develop symptoms. The common symptoms of COVID-19 includes fever, chills, cough, difficulty breathing or shortness of breath, fatigue, muscle or joint ache, headache, loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, and diarrhea. The virus is capable of progressing to severe symptoms and in some cases death, especially to older people and those with underlying health conditions such as heart or lung disease and diabetes. How can we tell whether someone is infected? The infection is commonly diagnosed by a test called reverse transcriptase polymerase chain reaction, in which this test identifies the virus based on genetic fingerprint. There is also a blood test that can check for antibodies against the virus, which may show that someone is infected in the past. What should you do if you suspect that you're infected by the virus? If you suspect that you're infected by the virus or was exposed and is currently experiencing the symptoms of COVID-19, it is important for you to stay at home. Monitor the symptoms. Rest and stay hydrated. Maintain distance from other people. and avoid using public transport or avoid public. If symptoms intensify, call a healthcare provider, local hospital, or clinic. It is important for you not to go to hospital yet unless emergency without calling first, to avoid exposing yourself and others from the dangerous virus. By doing this, you can also prevent an overflow situation at the medical facility or hospital. What are the treatments available for the virus? Most people who are infected by the virus can recover at home just by doing supportive care. Up until now, there is no specific or effective treatment for the virus. But there are already several experimental treatments that are being studied, such as fluvoxamine, antiviral drug Veklury, antivirals molnupiravir, and PH073-21332, which is developed by Pfizer. Though there is currently no specific cure for the virus, the vaccines are the hope to reduce the spread. Effective vaccines have now been introduced and are beginning to slow the spread of the virus. Why should you get a COVID-19 vaccine? It's important for you to get a coronavirus vaccine to protect your own self and others from the dangerous virus. COVID-19 vaccines are proven safe, effective, and can reduce the risk of getting and spreading the virus. Getting a vaccine also means helping in building a safer way of protection. And once fully vaccinated, you can start doing more things outside of your home. Right now, there are plenty of privileges given to those who are fully vaccinated, such as being able to attend face-to-face classes, being able to go and enter big malls and establishments, restaurant discounts, travel privileges, and more. In our country, there are currently 9 authorized vaccines, namely Pfizer-BioNTech, Oxford AstraZeneca, Sinovac, Sputnik V, Janssen, Covaxin, Moderna, Sinopharm BIVP, and Sputnik Light. What vaccine should you choose? All 9 vaccines were authorized by Food and Drug Administration, so these are all safe and effective. Just remember that before getting a coronavirus vaccine, it is important for you to talk first to your primary care provider if you have a chronic health condition. Learn a lot about vaccine. Get plenty of sleep, eat well, and be hydrated to ensure safety after getting a vaccine shot. Vaccine has side effects. For some people, the side effects of vaccine are not serious. The most common side effects of the vaccine are soreness where the shot is given, fever or chills, headache, feeling tired, muscle and joint ache. Serious side effects of vaccine are rare, and those are difficulty breathing, swelling of face and throat, fast heartbeat, blood rush all over your body, dizziness and weakness. As of December 28, 2021, about 107,277,506 total vaccine doses have been administered throughout the country, having 48,647,158 being fully vaccinated and 1,614,505 booster doses administered. How to avoid being infected? To avoid being infected, it is necessary for you to get a coronavirus vaccine as soon as you can. Wear a mask that covers your nose and mouth. Maintain social distancing. Avoid crowds in poorly ventilated areas. Avoid touching your face. Wash hands often with soap and water or use hand sanitizers. And follow the safety protocols implemented by the local government. As of December 30, 2021, there are 282,800,017 confirmed cases of COVID-19 having 5,414,213 confirmed deaths in the whole world. COVID-19 brought a lot of disruption and destruction to the world and life. It took millions of lives and brought pain to billions of people. This is a battle between us and the deadly virus. The strength of the weapons that we only have depends on ourselves. We must be responsible and disciplined in every way. For us to become responsible human beings, let's get a vaccine shot, because it will benefit not only ourselves, but all humankind. Let us fight against COVID-19 and don't let it take another innocent life. Everything has its own beginning and end, and this is now the right time to end the virus. And it all starts with you, with us. Once again, be vaccinated so that you are safe and others are safe. You know it. You know how to fight.